Hey everyone, I decided to do my topic on serious mental illness in older adults. Serious mental illness is also known as SMI, so I might refer to serious mental illness as SMI throughout my discussion. But the reason I picked this topic is because I work in a community mental health organization and I work with adults with SMI, and they're starting to get older. So there is a lot of issues right now with finding the best treatment for them, for me. So I thought I should look more into the topic. So, an interesting fact that I found when I was researching is that 2% of adults aged 65 or older in the United States, which is 7 million people, have serious mental illness. And that's defined as disorders such as bipolar disorder, schizoaffective disorder, schizophrenia, and then more severe depressions and anxieties. So, something also that I found that was interesting is a lot of these adults are actually incorrectly placed in nursing homes. And the reason this happens is because as these adults get older, some of the people that they live with, mostly family members and friends, age and they either pass away or they get placed in nursing homes, and then the adults with SMI don't really have anywhere to go and they don't have as many life skills, so they kind of get shuttled off to the nursing home, which is unfortunate. When I was reading about nursing home placement, I learned about the PASR. And the PASR is the pre-admission screening and annual resident review, which is given to residents before they go to a nursing home. And the purpose of this tool is to screen people to see if they're appropriate for placement in the nursing home. It kind of weeds out the people with SMI who really don't belong in the nursing home. And this is a two-step process. Step one just identifies if the people have SMI, and then step two determines if they do have SMI, if they're appropriate for nursing home placement, and also if they are appropriate for nursing home placement, it determines what kind of treatment that they need when they go into the nursing home. So I thought that was kind of interesting and a good piece of information for anyone who is looking to refer someone to a nursing home. You're going to have to go through a PASR. So let's talk about the fact that the PASR doesn't really work that well. There's been a lot of studies that I found that showed that even though there is a PASR, people are still getting stuck in nursing homes and they don't belong there. Some of the main reasons for this are adults with SMI suffer from a higher instance of medical problems. That's both from the psychotropic medications that they're on that cause medical problems such as diabetes, high blood pressure, high cholesterol. And also what happens is these adults have poor communication skills. They're not as readily able to take care of themselves, so they might get stuck in the nursing home. But they actually don't belong there because there are programs that are showing promise for these adults. One such program I found is called the HOPES program, and that stands for Helping Older Adults Experience Success. And this is a 12-month skills training program for adults with SMI. It's kind of cool. It couples 7 different learning modules with skill training such as medication management, and learning communication skills, learning how to ride the bus, learning how to talk to healthcare providers with community practice of these. So it's not just like, oh, let's learn about this stuff and then you throw them out to the wolves. They actually do skill training. So after they talk to these adults about learning how to ride the bus, they'll actually take them then to ride the bus. And they couple these skill trainings with then referrals to primary care providers to give them their annual visits and check up on their physical health to make sure that they're maintaining this. And prior to these appointments, they actually meet with a case manager who will help them go through and determine, what sort of things would they talk to the doctor with ahead of time and do a little bit of skills training in preparation for these appointments. So I thought that was kind of cool. So, in conclusion, SMI in older adults is a growing problem since the population is growing older, and there really hasn't been that much research in what to do with these adults, since a lot of the research has focused in SMI in younger adults and how to treat them and how to help them. So, some programs show promise. Like one I mentioned is the HOPES program. There's a couple other, but I don't have but I don't have time to go through them right now. So what needs to happen is a lot of community mental health organizations, such as the one I work for, need to start start implementing these programs to help older adults age in place so they don't get stuck in nursing homes. All right, well, that's it for now. Thanks.